The Health Services Research Conference in Melbourne, here talking to Professor Margaret Ullman Farinelli and her PhD student Stephanie Partridge about an mHealth project that was presented yesterday at the conference that got a lot of really positive attention, called Text to be Fit. And I was just going to ask Margaret to talk about the project a little bit, and in particular why, when we hear so much about the problems with obesity among children, why we should not really be worrying so much about them, but about the Gen X generation, and how the patterns of obesity in that generation are really where we should be focusing our efforts at the moment.
So just to explain, we have been putting a lot of effort into children for obesity prevention, and I do think we should continue to do that. However, we haven't been putting very much effort into the 18 to 30-year-old group. And some determinant research we did showed that they were facing an obese future with chronic disease at an earlier age than their parents. So then we started to look at their eating habits, and we realised they were born into what they term an obesogenic food environment, physical activity environment. So we started talking to some young adults about it, and the result was to develop a program that was based on mobile health, because this was the way they liked to communicate. Text messaging was something in particular they were interested in, and we were also trying to deliver information straight to their smartphone with apps. If they wanted to look at a website, give them short coaching calls to try and improve their lifestyles. And we actually found we were able to do that. We did it in a randomised controlled trial, and we gave them a 12-week mHealth program focusing on improving behaviours like fruit and vegetables, less takeaways, less sugar sweetened drink, more exercise if they could do it, and they were able to improve those behaviours. And importantly, when we looked at them again after 6 months, that either further improved or maintained those behaviours. So we thought we had a program that was designed with them, for them, by Generation Y, such as Stephanie, and it obviously resonated with them and was able to help them improve their lifestyles. So perhaps I can hand over to Stephanie, and she'll tell you where we might take the program.
That's great, thanks Margaret. Now, it's a really innovative approach to this issue, Stephanie. So what do you see as the future for this program, and what implications do you think it has for, say, health promotion programs more generally, particularly targeting this age group?
Where we hope to take the program. So in the future we're looking at delivering it to a large population. So it's been successful in our randomised control trial, but it needs to be disseminated to other populations. So particularly rural and remote is an important one, because those services aren't available in those areas. And also different socioeconomic groups. So looking at delivering it to through TAFEs and through services like that, so those type of people have access to the program.
Did you have a particular socioeconomic group in the trial that you did? So was that?
Sure. We did have a higher socioeconomic, so it would be good in future to trial that in lower socioeconomic areas.
Yes. Okay, great.
But we did get 30% calls, which was really good.
Yes.
And there was no modifying effect, whether they were from a core background or from English-speaking parents. So that was good. Also, we got men in it. It's often really hard to get men in these healthier lifestyle interventions, and we got 40% men, and in fact we can see that men do better than women. They both did well, but the men did even better, so we liked that about it. We thought that was good that we were able to do that.
And do you think it's translatable or has some sort of implications for health promotion projects addressing different lifestyle issues, such as, say, smoking or other?
There actually have been studies looking at using mobile health for smoking cessation that have had some success, although I don't know they've been targeted at any particular age group, but they have shown some success. There's been some success in some other lifestyle behaviours as well. So I think that using mobile health for health promotion, particularly in younger age groups who are really technologically savvy, shows promise.
Great. Thanks a lot, Stephanie and Margaret, and good luck with the future of Text to be Fit.
Great, thanks.